Coming up on KCCI 8 News Close Up, a panel of judges say they have problems with an order stopping Iowa from enforcing the mask mandate ban. We cut through the confusion over their ruling. And COVID cases are starting to fall, but not among younger Iowans. The warning coming from both doctors and the Polk County Medical Examiner. And Republicans at the State House are proposing 3 competing tax cut plans, the difference between the 3 and what worries Democrats if these cuts become reality.
This is Iowa's news leader. This is KCCI 8 News Close Up.
Good morning and thank you for joining us. I'm Scott Carpenter. Well, it's an issue that's divided Iowa all school year, mask mandates in schools. Last week, 3 federal judges handed down a ruling that schools are still studying. A little background here. Back in May, Governor Kim Reynolds signed a bill into law banning schools from putting mask mandates in place for students and staff. 4 months later, 11 parents of children with underlying health problems sued in federal court, saying mask mandates make it safer for their children to attend school in person and during the pandemic, and that the mask mandate ban violates the Federal Americans with Disabilities Act. Now, in September, a district court judge issued a temporary restraining order stopping Iowa from enforcing the mask mandate ban statewide, meaning school districts could require masks. In this ruling, the judge said he recognizes the restraining order is an extreme remedy, but added he believed it was necessary to allow those students equal access to class as the pandemic continued to spread. Governor Reynolds took that injunction to the 8th Circuit Court of Appeals, and last Tuesday, a 3-member panel of that court handed down their decision. The court agreed that an injunction stopping enforcement of the mask ban was proper, but that this particular injunction was overly broad, adding that preventing Governor Reynolds from enforcing the ban in schools that have no one with disabilities is a broader remedy than necessary. The American Civil Liberties Union of Iowa is arguing this lawsuit for the 11 parents in federal court. KCCI was there as lawyers explained what the court's decision means for schools across Iowa and when mask mandates may end.
The 8th Circuit Court of Appeals ruled that Section 504 of the Rehabilitation Act requires schools to impose universal masking rules when that's necessary to ensure that students with disabilities have access to a public school education. And so the subhead here is that the court did a couple of things that are really important. One of those is that it construed or read the Iowa law that we challenged as requiring to be consistent with this Federal Rehabilitation Act. So that means that in each and every school across the state, when it's necessary to require masking as a reasonable accommodation for students to go to school safely because of their disabilities, that Iowa law requires that. And then it found a likelihood of success on our claims that the state defendants, who are the governor, Defendant Lebo, and the named school districts, had been enforcing that law in a way that violated our clients' rights under those federal disability protections. And so for that reason, the court sent the decision back to the district court with instructions about how to frame it moving forward in light of that construction of law. I would say that this ruling held that the Federal Rehabilitation Act requires that schools provide universal masking when it's necessary as a reasonable accommodation so that students with disabilities who are more vulnerable to COVID-19 can go to school safely along with their peers. This means that the protection that they have under the current injunction continues, and it makes clear that they have a right to universal masking as a reasonable accommodation in their schools.
Okay, so and then the ruling also addresses schools that are not involved in the lawsuit.
So that means that just because they're not named in the lawsuit doesn't mean that they aren't required to comply with federal law. And the court interpreted this Iowa law, which has been called a ban because the state had been enforcing it as a ban. And the court makes clear the state cannot enforce it as a ban in that way, that it's not a ban because of these federal disability rights protections. And instead, every single school in Iowa has to follow that federal disability law protection for these kids.
The types of disabilities that make students more vulnerable to COVID are extremely common. Asthma, diabetes, sickle cell, et cetera. But there is, in theory, the possibility that we have in Iowa a school that may be very small without any children who are vulnerable to COVID. And there, the mask ban could apply. So it's a very limited, very specific exception, but the court did say that we can constrain the injunction that far.
She mentioned that the disabilities that make people vulnerable to COVID are quite common, but is there actually any limit on like a list of conditions that are covered by this ruling or covered by this law?
So the CDC, the Center for Disease Control, has been looking at the science and following which children tend to be hospitalized or suffer severe consequences from COVID. And they find that there's a strong correlation to the conditions that occur in adults as well. The additional, so diabetes, hypertension, lung problems, et cetera. The thing that was surprising for children was that it also found that children with developmental disabilities were much more likely to be hospitalized and to die from COVID. And the underlying reasons for that vary and are not entirely clear, but it is statistically shown to be a very strong correlation. The importance of this ruling is that it makes clear that having schools require masks is a reasonable accommodation under federal disability rights law. It doesn't say that that means that no matter what the condition of the pandemic, you must have masks or you must not have masks. We have always said that the masking requirement should be responsive to the conditions in the district, that it is going to possibly wax and wane given how the pandemic has waxed and waned. And the standard is whether there's medical evidence that would show that masking would allow a student with a disability that makes them more vulnerable to COVID to attend school safely. So that standard will change as conditions change.
Several school districts have since dropped their mask mandates, even though last week's ruling seemed favorable to the rule. Here in central Iowa, that included Ames, Marshalltown, Urbandale, and West Des Moines, citing the court ruling as a reason. Well, Governor Reynolds has opposed mask mandates, saying a parent should have the right to decide if their child wears one in school. Well, Reynolds had no statement after the court's ruling. KCCI's Amanda Rooker tracked down the governor Thursday to get her reaction.
On the mask mandate in schools, do you have any response to that?
Yeah, well, we believe that parents should have a choice on whether a child should be in a mask or not, and so we're continuing to look at it and see what our next steps are.
Well, that next step will be to appeal. The Iowa Attorney General will appeal last week's ruling to the entire 8th Circuit Court of Appeals. Tom Miller also said his office will not enforce Iowa's law banning mask mandates until the district judge issues the new injunction ordered by that 3-court panel last week. So that means for now, Iowa school districts can require students and staff to wear masks. You can count on KCCI to follow this case as it works its way through the courts. Next on Close Up, Polk County's medical examiner says the Iowans dying from COVID are getting younger. What's behind the growing number of cases?
Before the day can begin, you need to know what
Well, the surge of COVID cases from the Omicron variant looks to be waning here in Iowa. Friday, the state health department released numbers showing just over 26,000 people tested positive for COVID in the previous 7 days, down 16% from the previous numbers released on Wednesday. Positive tests haven't been at this level since the first week of January. But while COVID cases overall are starting to fall, cases among younger Iowans are on the rise, especially here in Polk County. Last Wednesday, the Iowa Department of Public Health reported 21% of the positive COVID tests in Polk County were kids 17 and under. Last week, Polk County Medical Examiner Joshua Akers and Dr. Joel Waddell with Blank Children's Hospital warned that growing number of younger COVID cases is leading to more hospitalizations and deaths.
The Office of the Polk County Medical Examiner has been keeping track of COVID-19 deaths since early April of 2020 and have continued to do so throughout the entire pandemic. Over this time, the average age of decedents has been 74 years. We have noticed, however, a decline in average age as the pandemic progresses. The average age of decedents in 2020 was 77. That decreased to 71 in 2021 and further decreased as of today to 69 in 2022. Furthermore, 10% of the total number of people who lost their lives to COVID-19 in 2020 were under the age of 60 years. The percentage of decedents under the age of 60 increased to 21% in 2021, and already in January of this year, we have seen 24% of our COVID deaths under the age of 60. The vast majority of these deaths are either unvaccinated or have not received a booster dose. The number of patients who are dying of COVID-19 in their homes is also rapidly increasing. Over half of all deaths occurring in homes have occurred in the past 6 months. Finally, in young people, those in their early 40s and younger, we are noting that obesity is almost universally present in their past medical history when they die of COVID. According to the CDC, obesity may triple the rate of hospitalization and greatly increases your risk of both severe disease and death. In summary, this disease affects a wide range of individuals, from our young adult to our elderly population. Chronic medical conditions such as obesity, hypertension, diabetes, and cancer have been shown to increase the likelihood of severe disease. Please do your part to stop the spread of this virus and to help save lives. Get vaccinated and wear a mask.
I wanted to touch base with the public and let them know what we are seeing in children who are hospitalized with COVID-19. It is still the fact that most children with COVID-19 infections have mild disease and do not require hospitalization. However, we have seen a significant increase in childhood hospitalizations over the last month. So we have had, from October to now January, we have had over a 300% increase in childhood hospitalizations at Blank Children's Hospital, and we fully anticipate it will be over 400% increase after the end of January. Like the adult population, in the pediatric population, the vast majority of children who are hospitalized are unvaccinated. Approximately 94% of children hospitalized with COVID are not fully vaccinated. Some of those children are not vaccine eligible, meaning they're under 5 years of age, but a large number of them are 5 years or older, and these hospitalizations could have potentially been prevented. Also of note, we have never had a child hospitalized in this time frame who has required ICU care or being on a ventilator who has been vaccinated.
That's all it is.
How was it?
This huge increase in cases is most likely secondary to the Omicron variant, which is highly infectious. Wanted to give a few examples of what we have actually seen in our hospitals. So we have seen a huge increase in young children, including infants and even newborns, who are hospitalized with COVID. Some of these neonates or infants under under a month of age have even required to be on the ventilator, and most of them got it secondary to their mothers having COVID at the time of delivery. We have also seen an increase in cases of children born to COVID-positive mothers, and the vast majority of them are unvaccinated. We have seen the gamut of ages. We have seen school-age children and even high schoolers who are hospitalized with severe COVID, and even healthy athletes who have had severe COVID and now will miss the majority or all of their sports seasons. Even more concerning is we have seen a large number of cases of something called multi-system inflammatory syndrome in children, or MIS-C. This is when a child contracts COVID, they beat the virus, but their immune system does not get the signal to turn off. And about a month later, their immune system starts attacking multiple organs in their body, and the majority of them have heart involvement, meaning they have heart inflammation and inflammation of their coronary arteries as a result of this syndrome. And we do not know the long-term outcomes of children with MIS-C. I have never personally seen a child with MIS-C who has been fully vaccinated.
Next on Close Up, 3 competing tax cut plans by State House Republicans, the differences in the 3 plans, and what they all have in common. Last Sunday, we told you about Governor Reynolds' plan to cut income, retirement, and corporate taxes in Iowa. Last week, Republicans in the Iowa House and Senate released tax cut plans of their own. Both the governor and the House GOP want a 4% flat income tax. Senate Republicans want a flat 3.6% rate, while Governor Reynolds wants to eventually lower the corporate rate to 5.5%. Senate Republicans are looking to drop it to just under 8%. House Republicans aren't proposing any corporate tax breaks. KCCI's Amanda Rooker sat down with Republican Senate Majority Leader Jack Whitver, who says despite the differences, tax cuts will pass this session.
Walk me a little bit through that. And I know there's been calls, among, Senate Republican colleagues to totally eliminate the state income tax. Is this the goal, with changing the taxpayer relief fund?
Yeah, we've had a taxpayer relief fund in place for about 10 years now, and it collects money, but there's no mechanism to reduce taxes in that. We have to come back and implement tax bills. What we would do with that taxpayer relief fund is, as that accumulates money, we automatically ratchet down the rate as we march down towards a zero tax rate in Iowa.
So as part of this whole proposal, you're not suggesting eliminating the income tax this year, but is that the ultimate goal?
Yeah, as we've said all along, the ultimate goal to make Iowa the most competitive we can with taxes is to get to zero. And so one of the steps in that is getting us to a flat rate. And so it is absolutely necessary this year that we get Iowa to a flat rate. And then as we march forward, whether that's through the taxpayer relief fund or future tax bills, that's when we hopefully can get to zero. But that should absolutely be the goal. And this step to get to whether it's 3.6 or 4 in the governor's bill, it's really important that we get to a flat rate this year.
So some people on the other side of the aisle say that, there's been a lot of talk about surplus, right? They say that some of that is due to one-time dollars from, the Biden administration, and that it's not necessarily reflective of what our budget will look like long term. What's your response to that?
Well, we worked within the Revenue Estimating Commission that we have here in Iowa to give us projections for the next few years, and we work with the 5-year plan on where we think revenues will be and where we think our budget will be. And this tax plan fits within that 5-year plan, and I think it provides the tax relief that Iowans need.
What about property taxes? I know people hear, income tax cut, corporate tax cut. Does that mean, we're hiking property taxes?
No, this will have no impact on property taxes. We're certainly concerned about property taxes, and we've put in place several measures over the last 5 years to add more transparency and try to hold those property taxes down. And so it's something that we're always worried about. We always think about that. We always want to provide more transparency and keep those rates down. A lot of that's at the local level. And so that's where over the last few years, we just want to put transparency into the system at the local level so that they can keep those rates down.
Now, Democrats in the legislature say they agree with Republicans on one thing, that's Iowans deserve a tax cut. But Democrat Senate Minority Leader Zach Wahls said he fears when income and corporate taxes fall under these 3 plans, property and sales tax might go up.
So we've got some really serious concerns about it. I don't think that rushing through a 118-page bill is a good way to make policy in this state.
A couple of quick things. So you keep saying that proposals are going to raise taxes on lower income Iowans, and if you could just elaborate on that a little bit to give me a little bit more specific about how you see it raising taxes on people.
So the 2 primary pieces of concern that we have, one, we know that obviously we already talked about sales tax, and that's something that we'll see affect hundreds of thousands of people. And this is not, by the way, my own personal view. Iowa State University economist Dave Swenson, who is an economist and an expert in this area, has spoken repeatedly about how the governor's tax proposal and additionally the Senate Republicans' proposal will in fact hurt poor Iowans and middle-class Iowans. I would say the second piece, and we see this very, very consistently, is that when Republicans make income tax cuts here at the State House, we see local governments try to make up a lot of what happens on the back end with higher property taxes. We know that when Republicans broke their promise to Iowa voters last year and ended the so-called backfill, which helps keep property taxes down, we know that that's going to have a consequence for cities across the state. In fact, just last week, I received an email from the city manager of West Branch, a town in Cedar County and the birthplace of President Hoover, that because of Republican tax policy from last year, they're going to be increasing property taxes. And so we think that this is not a good way of making tax policy, and we know that it's going to wind up hurting Iowa families all over the state. We talked about this for a long time, but I think that the focus needs to be on having a more simple tax code. That eliminates deductions and credits, but you can do that in a way that is revenue neutral, not a huge giveaway for corporations and millionaires.
Up next, we take a look at some of the other bills moving through the Iowa legislature.
With a credit union, 100% is the
Well, the Iowa legislature once again is taking up the issue of distracted driving. Last week, the Senate Transportation Committee passed a bill increasing the fine for anyone caught using an electronic device while driving to $100. The fine is currently $50. Now, this bill does give exemptions for using hands-free devices and for public safety and emergency workers. It now goes to the Senate for debate. Well, thank you for joining us for KCCI 8 News Close Up. We hope you enjoyed the program. We will see you back here next Sunday, same time. Have a great day.